Hello everyone, we have with us Associate Professor Michael Jura. He is the head of the Ophthalmic Engineering and Innovation Laboratory and also co-heads the Bioengineering and Devices Research Group at Singapore Eye Research Institute. Today he is here with us to speak about his latest paper, which is probably the largest optic nerve head biomechanics study to date. And over to you, Prof. Jura. So can you tell us a bit about glaucoma in general and how does it relate to this study?
So thank you, Lashmi, for having me here. A pleasure to be here. So glaucoma is a disease, it's blinding disorders, and it's defined by damage to the optic nerve head. Optic nerve head is a very fragile tissue at the back of the eye, and this is basically the definition of glaucoma. Before, people thought that glaucoma was defined by intraocular pressure, high intraocular pressure. The pressure within the eye is high and you get glaucoma, but this is not true anymore. We know that today we have patients with normal levels of pressure, so normal levels, and they still get glaucoma, they still get damage at the back of the eye. So there's another group called high tension glaucoma, and those patients do get glaucoma with high elevated pressure. So how do people get glaucoma? There are many theories out there. One of the theory is a biomechanical theory of glaucoma. And basically, if there's too much stress to the tissues due potentially to high pressure, it could actually damage the cells at the back of the eye. But there's many ways that you can create high stress in your environment or high deformations. You could change the stiffness of your tissues. And so, for example, if I just take a simple example, if you take a balloon, there's two ways for the balloon to burst. Either the pressure will go too high and the balloon will burst, or you weaken the wall of the eye, or wall of the balloon in that case, and the balloon will still burst. So it's still plausible that you could have patients with normal pressure, they will still get damage to their cells. So this whole concept of the biomechanical theories. And over the time, people have discovered new loads, such as optic nerve traction. We have pressure as well from the back of the eye, starting from the brain, the cerebrospinal fluid pressure that is pushing the optic nerve head in the other direction. There's a lot of other forces, orbital fat pressure, that we're still really scratching the surface. So glaucoma is really complex. We still don't know all the mechanism leading to the cell damage, but we truly believe that mechanics is a really key component of the pathology.
What did you try to study in this?
So in this paper, we just published in Ophthalmology last month, we used a mechanical test in patients, and maybe if we can see on the video here, we can see the optic nerve head deforms as a function of pressure. And basically the test that we did, we just gently poked the eyeball with something called an ophthalmodynamometer to increase the pressure within the eye. When the pressure was increased, we would expect deformation of the tissue, because remember the optic nerve head is a soft tissue, so things will deform a bit, like shown in the video. And by understanding the deformation of those tissues, we may be able to tell whether the optic nerve head is robust or is it fragile. And if we have this information, then that might be very important for us to say, oh, maybe this person has glaucoma, maybe this person will get glaucoma, or maybe this person will go blind very, very fast. So the nice thing that we did in that study, we actually used two groups. One group, normal tension glaucoma patient. So again, glaucoma that occur at normal level of pressure. And we use high tension glaucoma patient, glaucoma that happens at high level of pressure. And we really want to study the biomechanical differences. Are they biomechanically different? Because we don't know. These studies have never been done before. We know very little about the mechanics of the nerve in vivo. And then another aspect that we did in that study, we linked that with visual field loss. So visual field test is a way to measure blindness in patient. And it's a functional measure, really. And we correlated the measure of mechanics, so how much the optic nerve head deforms is respond to pressure, with a measure of blindness, because that may tell us something about the importance of mechanics in glaucoma pathophysiology, basically.
What did you see was the difference between the normal tension glaucoma and the high tension glaucoma subjects?
So very, very interesting results in my opinion. And the reason why we're able to see those results first is because we used a large population. You know, most studies in mechanics have used small population, 20 patients, 30 patients, and in my opinion, that would be considered very small. Glaucoma is a very complex disease, it's a chronic disease, many different stages. So I think it's important once you do a glaucoma study to have as large number as possible. Here we're able to reach about 116 or 115 patients per group. So we had about 230 patients that did mechanical testing. And again, I believe this has not been done before worldwide. And because we were able to do that, we were able to see that there was a correlation between mechanics, so the amount of stretch, and visual field loss, basically. So it means, especially in high tension glaucoma patients, so the more stretch the eye in response to a change in pressure, the more stretch they exhibit, the more blind the eye is. So very, very interesting in my opinion. And this was true in high tension glaucoma patients, but this was not true in normal tension glaucoma patients, basically.
So that means their condition wasn't as severe?
So, no, it doesn't necessarily relate to severity, but it means the normal tension glaucoma also exhibited some degrees of blindness, but that means maybe there's a different pathway that is not linked to intraocular pressure. Of course, the studies that we did does not imply causation yet, right? So this is just a cross-sectional study at the moment. So we just look for association. We don't mean stretch creates blindness. This is not what we are saying yet. But there is some evidence that it might be the case for many, many studies around, including ours. You know, it shows that mechanics, yes, may play a very, very critical role in glaucoma. So for the normal tension glaucoma patient, if we don't see that relationship between pressure and visual field loss, it means that there could be other aspects in this group of patients that could create the damage to the cell. It could be blood flow. You know, the big hypothesis in normal tension glaucoma patient that blood flow is really, really important. There might be ischemic factors. There might be molecular, also genetics component, something related to the cerebrospinal fluid pressure, something related to eye movements. So we don't know, but it means that it might be a different disease, basically. So glaucoma, we think it's one entity, but glaucoma very, very likely is 20 different kinds of disease. It's like, if I give you an example, if you take a motor of a car, right? And if the motor breaks, there's many ways for the motor to break. So the motor break is like the person going blind, or the optic nerve head getting damaged, the person go blind. When the motor breaks, there's many ways it can break, right? There's rust, there's a problem, the oil level, the water level, there's a piston not working properly. So it could be the exact same thing in glaucoma. One type of glaucoma is pressure is too high, damages the cell, kills the cell. You know, this is clear. On another type of glaucoma, it might be more complicated. It might be blood factor, ischemia, cerebrospinal fluid pressure, optic nerve traction due to eye movements. So we don't know. But at least we're trying to tease out the spectrum of biomechanics to really understand that question. So I think for me, it's actually very, very fascinating that we can try to answer these questions.
Right? Yeah. It does seem intuitive that more pressure would actually cause visual field loss. But then why do you think it took so long for people to actually do a study of this?
So we knew it for a long time. In animals, it's easier to do that in animals, of course. You can control very well. So you can increase pressure in an animal. And if you increase IOP to, let's say, 30, 40 millimeter mercury for, let's say, 3 weeks to a month, the animals will get blind, right? This has been done in a lot of animal studies. And probably the same in humans, but of course we cannot do that in a human. And glaucoma is very chronic. It takes years to set up. You know, it can take 10 years for your vision to be affected. So it can be, it's a chronic disease, different speed across different patients. So, and doing a mechanical test in a patient is not easy, because you know, you want to stretch your tissue, you want to be able to image, you know, OCT, which is a 3D imaging mode that we have, only came up recently, about 10, 20 years ago. And so then it's pushed this type of study. Now we're really trying to look, we have the speed of acquisition to see movement in 3 dimensions. So we're really in 4 dimensions here. It's like a 3D object moving. The dynamic of a 3D object, so time is your 4th dimension, so we have very, very complex data to analyze. And since only recently with computational tools, the improving of the imaging methods, that we can really start to see those relationships very, very accurately.
I think technology has really helped you.
Yes, technology has been a big important factor, yes. And like I said, so this is only a cross-sectional study, and we are already seeing very interesting trends in this population. But the nice thing, we've just received funding from Bright Focus Foundation, which is a glaucoma charity in the US, and also from LCG grant funded by NMRC here in Singapore. So with this funding, we'll be able to follow those patients longitudinally. So we're gonna, of course, these patients are being treated as best as we can treat them, but we will still follow them to see, you know, could mechanics explain anything related to how their disease will progress. Excellent. So then we might be able to answer for the first time whether really mechanics is really the trigger and the cause of glaucoma, and that could be very big. So we believe that this study is the first of many to come in the future once we follow those patients longitudinally and learn more, basically.
That's very interesting. Thank you so much, Dr. Gerard. I hope that you know your group continues with the longitudinal study, and we have very effective measures to intervene with the disease. And thank you so much once again for joining us today. Thanks a lot.
Yeah, thank you. Pleasure to be here again, and have a good day. Thank you.
Thank you.